We're moving on to the next presentation for the day. We're having Dr. Praveen Arani. Welcome, sir. Dr. Praveen, welcome, sir.
Hi, how are you?
Fine, sir. Thank you. Hopefully, you're also doing good.
Yeah.
Dr. Praveen completed Masters from the Rajiv Gandhi University of Health Sciences, after which he obtained certificate course in Clinical Research Curriculum, National Institute of Health, USA, and Masters in Medical Sciences, Harvard School of Medicine, completed doctorate, Biological Sciences in Dental Medicine from the Harvard University, awarded for Horace Furumoto Young Investigator, and also Best Laser Research Paper, Laser Annals 2015, presently serving as an assistant professor, Oral Biology, School of Dental Medicine, New York. Over to you, sir.
Great. Thank you for that kind invitation. And I'd like to thank the organizers for inviting me to give this talk. Can you see my screen share?
Yes, sir.
All right. So I am going to speak about a little bit about my research career, opportunities in dental research, and hopefully show you a couple of cases. I mean, the last speaker was amazing, and the series of speakers have been amazing. So I've been listening to them. We've always, as dentists, those are the kind of cases that motivates us to do more research and more clinical training. So hopefully I'll show you some of the research parts of what we can do as dentists. And hopefully you'll take that message away that even dentists can be renowned researchers if they put their effort into training and learning and asking the right questions. So these are my disclosures. These are the following entities that support our research. And I'm currently employed at the University at Buffalo, and I have patents from Harvard in Buffalo. These are the organizations that I also work with. When I talk about the kind of research that we do, we work with a very specific type of laser or light treatment. It's called photobiomodulation. And you will see that there are lots and lots of clinical applications for this specific treatment. And there are organizations, as shown in this chart, where we are trying to promote photobiomodulation into mainstream medicine. So let's begin with a history of medicine. There was a time in the practice of medicine when drilling holes in people's heads was considered medicine. People used to think that disease is one of the reasons you get a disease or any kind of disorder is because you have bad spirits in your head. And by drilling a hole, they thought they were curing people. And again, some people got better, but unfortunately, a lot of them did not. And even very good medical textbooks in that era have different documentations of different devices used to drill holes, as shown in this image here. Drilling holes in people's heads is now a standard of care for a very specific application. And I'm sure you remember from the days in anatomy about the Bregma point on the side of your skull, where increased intracranial pressure can be relieved by simply drilling a hole in a precise area. So this is now considered standard of care. The reason I bring this up is because a practice of medicine, which was considered at that time to be beneficial to some people, has become a standard of care because we now understand the precise biological and the clinical context in which we would like to do this procedure. Similarly, if you look at various other medical procedures, whether it's bloodletting, whether it's taking out large parts of your brain, a lobotomy, or simply applying mechanical force to change your posture, or in our case, teeth. These are procedures that were known to exist before. The reason that we actually use them in practical day-to-day life of medicine and dentistry now is because we understand where and how to use these procedures for the most effective therapeutic outcome. So research has shown us that changing bloodletting in its more refined form, such as transfusions and dialysis, relieving epileptic seizures in the brain by very specifically ablating with high-power lasers epileptic seizures sites in your brain that can be identified by functional MRI imaging, or as we all know, we can actually very precisely move teeth and bones if you have heard of the term distraction osteogenesis. We can elongate bone, and even orthognathic surgery, right? All of these are procedures where we can apply controlled mechanical forces to get therapeutic medical and clinical outcomes. So the difference between a procedure that was somewhat useful long back, documented in all these books and paintings and different texts, some of them are even practiced today. And the big difference is, as a clinician, someone was paying attention that if I do this procedure, I'm getting better results. But then they had to do a lot of research to understand why it would work in a very specific case. So as clinicians, we are all scientists. So every patient who walks into our clinic is nature's experiment, right? A disease is a manifestation of nature's experiments. And if we pay attention, and I'll come back to this point again, we can actually help move the field forward, even as just straight practicing clinicians. Now, what do you recognize? And I think that's the tagline here. What do you recognize as a problem is obviously the key to doing research and research methodology. So if you look at the history of dentistry, and I recommend looking at the American Dental Education Association, there is a very nice timeline of how our profession developed, right? There was practices or different types of dentistry was practiced even in the ancient civilizations. They have found mummies and various dental tools in ancient civilizations, the Indus civilization, the Egyptian civilization, and I have an image coming up showing the other ancient texts. So we always knew that dentistry or some form of dentistry was always practiced. And there was this concept that tooth disease is because similarly to the head and creating a hole, they used to believe that this is the Dante's image of how you might have devils or demons in your teeth that cause dental disease. And again, drilling was an extension of trying to relieve those tensions. But we now know that this is better organized. And one of the first things that people did was carefully document what is happening during tooth decay. And Pierre Pochard, as you know, is credited with being the father of modern dentistry, who actually put together these observations into the first textbook, or a book which he called The Surgeon Dentist, which basically outlines the biological rationale of why we should drill the teeth when it is decayed, right? And then you can look at the ADA website. As soon as you have a textbook or a text that organizes information, you can start teaching it. And that led to one of the first dental schools being made, being established, and this was back in the 1840s in Baltimore. And again, this is very US based, but you understand that all around the world, the fact that you have a textbook organizing your field led to dental education and various dental associations that began to institute various forms of learning and training. And I'll make a plug for our school here. So both the Harvard University Dental School was formed as a part of the University Associated Affiliated Dental Institution, and the School of Dental Medicine at Buffalo was formed way back in 1868. Interestingly, again, I'll come back to this. Our school is known for many, many esteemed, renowned researchers and clinicians, but our department, which is the Oral Biology, Department of Oral Biology, was the first in the country and apparently in the world that actually focused on dental research training. And there's a very nice YouTube video talking about the history of our department specifically. So these are some of the images to tell you how people used to practice dentistry even before it was an organized profession. We have lots of these images, but, and again, the ADEA website talks about how the early practitioners of dentistry basically evolved from surgeons and barbers who used to cut hair, tooth being another appendage of the body. And there used to be an organized system that evolved over different time periods. So we have evolved significantly, and these are just some funny and not so funny images. And you know, dentistry in mainstream media has always got a bad rap. And this is how some of the representations of the more, I would say, older practices of dentistry was performed. Of course, we got a lot more sophisticated. And again, these are just some funny pictures of how people show dentistry. We know that we are much, much more elegant. And just this last image here is one of these organized efforts. And you can see he's not wearing gloves And in this era, he's not even wearing a mask. So I think there's a lot to learn from these art history. But moving on, I think one of the big changes that's happening in dentistry, and the first speaker was very astute to identify that there's a revolution in dental education, right? And what can dental research bring to the table? So why research? We all trained, and I also got my BDS and MDS from India. So we all trained to become clinicians. So why should we be worried about cells and mice and all these other things? So the reason, one of the main reasons, I know dentistry is just definitely differently organized in India compared to the US. But what I think every institute around the world is trying to do is to bring dental research into the undergrad or the pre-doctoral curriculum. And the reason for that is because the way we are imparting knowledge is changing, right? A single book led to a lot of advances in the field to organize dental courses. But now the pace of development has picked up so significantly that people are no longer dependent on this old model of libraries and books and looking at different recommended texts. I think even I know my colleagues in India for sure. Many people are now recommending the most recent review article rather than a textbook or a chapter in a textbook. So I think we are evolving very, very quickly, and we are all very, very aware of the new digital era, right? There is no limits to your learning. You're not restricted by what is being taught in the school, what is taught in your textbooks or your recommended reading. You can learn actively from various resources. And one of the things that increasingly has become our job description now is to follow some of these information. So Wikipedia is a great resource. We use it extensively. It's a great starting point. It is not the definitive resource, but even I'll show you some of the research that we do. It's a great place to get a new student oriented, or any faculty or any researcher oriented to where the field is at. And there are fantastic clinical procedures as well as research procedures now that you can see on various social media. So this has become the new library, if you will, the knowledge base. And none of it is restricted, right? So students can actually Google. We work a lot with lasers. So people can actually Google the latest laser frenectomy procedure. And the previous speaker spoke about some very elegant surgical cases, but how do you do that with a laser instead of a scalpel? There are some very, very nice videos and training guides. So as teachers or professors trying to teach this program, one of the jobs that we have recently taken over is to try and curate whether these videos are reliable and whether they should be recommended. So I'm sure this is happening actively even in India and in pretty much in every form of higher education. And we are, again, just to reiterate the fact that we are not limited by what we are learning from any given resource. There are several resources. You can take a molecular biology course if you're interested, or even a basic course on dental anatomy from some of the most prestigious institutes now. And some of them are already free, but a huge movement now is trying to make many of these resources free. So, and I'll give you an example at the end where, someone who's discovered something very important that is changing the way we practice dentistry, you can listen to that person give you the lecture on any topic of your interest. I saw a question on forensic odontology. So there are some renowned researchers that you can actually get in touch, and they teach many of these courses and give talks online to make their information available. So the reason I think, and this is primarily driven to the dental students who are thinking about advanced training, why should a dental student do research? Is because there are two silos of information. There is knowledge, which you must learn, and you must have foundational clinical base from which to build. And dentistry specifically requires hand skills, right? So you must be able to do the main thing, diagnostic skills, technical skills, and communication, which is becoming even more central now. There used to be a time when the patient came in, you found out what the problem is with a quick oral examination, and you did the examination. But we are realizing very quickly that treatment doesn't start and stop with the procedure. It starts and stops with the patient. So communicating what you're doing, what results are expected, and what can be the outcomes of either not proper treatment or inadequate treatment or follow-ups is a huge part of your complete training spectrum. And as a clinical treatment giver, you must know you must have good communication skills. So what does research bring to the table? You know that every case is not a cookie cutter. Every person who walks in, you don't do the exact same procedure. There will always be outliers. There will be slight differences. And nowadays, the patients are much, much more sophisticated. They actually come in with their own treatment plans, and they want a very specific kind of denture or implant system. In our case, lots of people come in with a very specific laser procedure that they want performed. So they are actually very informed, if you will. And you may not be for that procedure and that specific topic. And you have to very quickly look at where the literature is. Can I scan through where is the information and whether it's reliable, right? So you need to be able to do these kind of skills in real time. And that's not something that I was taught as a dental student. And I'm guessing neither are many of you who are actually undergoing dental training. We are all taught to read a specific information and reproduce and apply it. We're not taught to look for new information. So that skill where you're actually finding new information and synthesizing the relevance and understanding whether it is useful for the current case or the current clinical treatment, that is research. And that's a very simple but relevant definition for why, as a dental student, you should understand research. And if you have an opportunity, get involved with research. I saw that video that was played before. That's a very, very impressive infrastructure. So I'm sure I saw centrifuges, I saw PCRs. So there is, I think, ample opportunity as undergrads, pre-docs, or even as dental residents. I think you're required to do training in research as a resident, but there is lots of reasons for you to get involved with that kind of research training. And that basically, this slide basically summarizes that. So we teach you facts and theories, we teach you methods, and in dentistry, we actually teach you skills, hand skills. But all of that gets integrated in what we call education, or formal education, a course or a degree. But research enhances that. And to get involved with research at any point in your career, even as a faculty, I heard several faculty members had grants from ICMR. At any point in your career, getting involved with research cultivates this thought of lifelong learning. And that's the mantra. If there's a success mantra, the other mantra in life is to continue to learn, right? And that research teaches you those skills and the pathways to do that kind of work. So I'd just like to give you two examples of this. If you have been to Boston in the US, and hopefully you had a chance to visit one of these, or you might have seen it on television, Mass General Hospital, there is a very, very unique building right in the middle of that campus. And this is the building here, and it has a very nice looking dome. And this is probably one of the oldest buildings still kept intact the way it is, because of a very, very important reason. So the important reason is right in the middle of this dome, right below that, we have this old school theater-like lecture room, right? And all of the most prestigious lectures are actually invited into this space. And it's a very small space, but to be giving a talk here is considered very, very prestigious. So they have some grand rounds and they have a lot of training in this room. But the reason that this room is very famous is because it is believed to be the birthplace of modern medicine. The birthplace of modern medicine because of this one portrait image that is pretty much in every building in any one of the Harvard schools. If you go into the library, if you go into any of the med school campuses, you will see this poster again and again, this painting again and again. And this is the first patient, documented first patient who's been given general anesthesia. And he's being given anesthesia with this small apparatus here, which you can see in his hand, is a glass flask. And there is inside that, you can't see it very clearly. I think I have an image coming up. There is a flask inside with a sponge, which is soaked in ether. And this was the first use of inhalation anesthesia for this surgeon to perform his abscess drainage. This gentleman here, whose portrait is on the left here. So among all these prestigious medical colleagues, there is this one gentleman who's giving the anesthesia, and he is a dentist. So this particular dentist, Dr. Morton, actually did a lot of research in his own time and found that by giving him anesthesia, of course, dentists being very familiar with pain, he was looking for a solution for his patients, but he found that ether anesthesia works really great as a way to subdue the sensations and allow painful surgical procedures to be performed. So a dentist is a part of history as one of the contributors to the birthplace of modern medicine. So we should be very proud of being in this profession. Here's another example where this particular patient was getting implants, and this patient came to this clinic, and found that you would actually get this necrosis of the jaw. You all know this very well. So previously it used to be called bisphosphonate-related osteonecrosis. Now it's called medication-related osteonecrosis. But again, the dentist who was seeing this for the very first time, Dr. Marks, he actually had the training and the background and the foresight to recognize that this is not just a necrosis that is occurring because of some unknown reason or a rare reason. He actually made that correlation with an osteoclast inhibiting drug, right? He made that connection with bisphosphonates, and therefore the whole field has actually benefited from treatments. And we now have a very clear protocol on how to manage these patients. So if you're asking the question, what do I do as a dentist and how do I get involved with research? There are many, many ways of identifying a dental research problem. So dentists, as all of us as practicing dentists, I don't practice anymore, but as dentists, clinicians, we are very, very good at replacing lost dental and oral structures. And here are some examples of very well done prostheses and crowns. And I, whenever I look at this, I always think that these can actually fit in a museum because they are such beautifully done pieces of metal and polymers that are being fabricated. But something that's revolutionizing our field is recognizing that these things, and I heard one of the, I think it was one of the speakers or in your video, talk about how we are engineers, right? We are also engineers because we are clinicians who are trying to place a structure inside the mouth, which has lots of mechanical, microbiological, and immunological barriers. And that's very unique to us. Maybe the closest to something that we do is orthopedic surgeons, but no other profession, no surgeons actually tries to put in an artificial material that has to survive these mechanical forces, biological assault, as well as the saliva and the immunological factors. So we are pretty sophisticated in the way we practice medicine. And unfortunately, again, another perception of medicine is that it's painful, but most of our patients actually are like this. They are much, much healthier and happier after they get dental treatment. So all of these factors can help us identify what kind of research we want to do. And people who do research with single cells, this is just an example of yeast and planaria, zebrafish, frogs, fishes, and higher animals. All of this research is meant to improve our clinical care. And there is actually a roadmap. So if you look at the NIH, the National Institute of Health definition of different types of research, there is a roadmap based on the kind of research we do that will enable better clinical practice. And all of us obviously are placed at the T2, T3 level. And some of us would like to do basic science where it gets that information to the clinical care. So as a beginning point, most of us are focused on clinical research and clinical practice. But I started my career as a dentist, so I thought this would resonate with most of the audience here. I actually did my BDS in Belgaum in India. And after that, I did a research fellowship at the Indian Institute of Science, where I was asking a very specific research question, which I'll come to in a second. And this led to further training. So, and I also have a slide at the end talking about this. For someone who's trained as a clinical sciences person in India, because we don't have the benefit of 4 years of college, most people in the US have to go through 4 years of Bachelor of Science or a BSc degree before they become DDS, before they start DDS. So they have a very, I would say, a stronger foundation in basic science. We didn't have that, right? And the system in India does not allow you to do that. So these two fellowship trainings were, for me, the beginning of research. And this led to a lot of other training. And again, formal education in India is very different than how you do stuff here. And that's actually my professor with whom I did my PhD. And then I led to my first position in the NIH. So before I came to Buffalo, I used to be a clinical investigator at the National Institute of Dental and Craniofacial Research. This is my lab group there, and I'll show you some of their research. And many of them, I should point out, are actually dentists now. So Monica, Eliza, Heather, all of these people have actually gone on to, and Abhinav here, all of these people have gone on to either dental or medical careers after doing research training. This is my current lab in Buffalo, and again, lots of students. We have a big lab here and a lot of variation in the background in their training. I have dermatologists, we have ENT specialists, we have lots of dentists, obviously, in my group, periodontists, orthodontists, and then a lot of undergrad students. So for us, undergrad means when they're going through their Bachelor's of Science degree, and many of them will end up in dental school. So in this picture, I think there is Nicole, there is several of these students, Jacob, Jay, all of these guys have actually ended up going to dental school and taking on dental school training. So, and our school is actually very, very well known for the research capabilities. And I don't know if you recognize any of these, but I heard the WHO guidelines being mentioned. So Dr. Michael Glick, who was the former dean of our school, is a central part of that committee, which came up with the oral health guidelines. Dr. Van Dyke is the director of Forsyth Institute at Harvard. This is my chair, Dr. Frank Scanapecco, and that is Dr. Larry Tabak. He is the current deputy director at the NIH, National Institute of Health. And these are some of the most renowned professors that hopefully have seen their papers, Dr. Bayer, Dr. Jenko, and Dr. Ciancio, and some of the pioneering work on how gum disease affects cardiac disease and preterm pregnancy. My dean, Dr. Zambon, was also involved in some of this research that came out of our labs at Buffalo. So a great place to train and a great honor to be working in that area. So at this point, I'm going to switch track a little bit from being very general comments to a little more science comments, a little more technical scientific comments. And I'll try to go a little more slowly, but I'm happy to take questions at any point. You can, I don't know how this works. Either you put it in the chat box or you put it in the question and answer session, but I'm happy to take questions there. So there are various ways to find a topic in dental research. And again, you can go by the specialties, which I think you're already hearing great talks already about. You heard about 3D printing, you heard about different surgical techniques. And then again, if you go to the very basics of what they're doing and how they're doing their stuff, you will actually narrow down onto either biological or biomaterial approaches. So my lab is specifically focused on biomaterials and biotechnologies. And I'd like to show you some very brief examples. I'll try not to be too technical, but very simple examples of what we are trying to do with these two areas. So we know that biomaterials were designed to be biocompatible, right? We wanted them to be completely inert. They should not respond to any kind of immune reaction. So we just wanted material that you can either put in the mouth or implant under the tissue that will always be inert. And there are several examples of that. And this is what we would call the first generation of material. We soon found out, especially when we started doing bone reconstruction, that materials that are more conductive, that allow tissue to proceed, will actually be even better. But they don't directly contribute to the new tissue, but they are conductive in nature. So you've heard the term osteoconductive. And then as we learned more and more about these materials, especially with collagen scaffolds, we realized that we could actually make the material contribute, either with or without cells, to the new tissue that we want to make. Whether we want to make bone, we want to make soft tissue, we want to make more complicated organs. It is now possible to use inductive material, which actually actively contribute to the new tissue you want to form. And something that my lab is very focused on, and several labs around the world is focused on, is the next generation of material, which is a smart material, which is sense and respond material. And one of the easiest examples for this is a depot under your skin that can actually respond to higher levels of blood glucose, right? We know that we have to give insulin to patients who have diabetes, but giving them insulin usually pulls the blood sugar down quickly and sometimes unsafely. So if we had a system in the body that had a depot of insulin, just like how our internal organs work, we are inspired by biology, and I'll come to that again in a second. But just if we had a system that could sense the low blood glucose and then secrete insulin, we could be able to respond in a very effective manner. To give you a more relevant example in dentistry, we all know that materials will eventually fail. No matter how good your technique is, no matter how expensive the material is, it will eventually tend to fail. And obviously, doing a good restorative procedure will ensure that the design is robust, but the material is prone to fail because of the nature of the material. So there are several advances now where we have something called self-healing material. One of the reasons that materials fail at the interface and lead to micro leakage is because the material tends to degrade and disintegrate. But if we had depots there in that area at the edges, which will sense the crack and release new polymer that will again establish a seal, we can actually extend not only the life of that restoration, but ensure the health of that patient. And there are various very, very sophisticated material approaches now. And that's a mechanical way of sensing. There are other ways of, you have heard about chewing gums that can tell you when to see a dentist or when to go back to a periodontist for treatment. And it simply is like something that changes pH. And it can change color, it can give out a bitter taste, which will diagnose the disease. Having collagenase in your tissues, which leaves a substrate which makes it bitter, can tell you by just simply chewing a gum that you need to see your dentist right away. So these are some examples of smart systems, and we do some of that research, but I saw in the program that we have a 3D printing interest. So I'd like to show you how 3D printing works. So all of us are familiar with this picture where patients, unfortunately, come back to us with candidiasis, right, oral thrush. And no matter how good your technique is, even if you put in a reliner, we know that the interfacial presence of the candida is responsible for this unfortunate inflammation and pain and discomfort. So these are just some images showing that, and unfortunately, people who wear dentures are elderly and they have limited manual dexterity, so they have trouble keeping their dentures very clean. And again, you can prescribe all kinds of things. This is just an image of the candida in the tissue and fluorescence microscopy, scanning electron and fluorescence microscopy showing you the candidal growth. So one of the projects in the lab, actually led by two dentists, who's now one of them is actually, both of them are now faculty. Alex and Malvika were dentists and are now dentists and faculty, and Jacob is finishing up his dental school right now. So all of these guys got together and they decided, what can we do to improve this candidal infection in the denture? So on your left here, you see a regularly processed denture. And on the right here, you'll see a 3D printed denture. And of course, you can criticize that and say it's not perfectly well done yet. And this is a crude print from commercially available material. And I'll show you some new research afterwards. But our innovation in this area, and for those of you who have already tried 3D printing, all of this work is published in Material Communication here. Anyone who's tried 3D printing knows that the mechanical strength is less right now, and we are trying to improve that. So our innovation was just using a very, very simple benchtop printer. We call them hobby printer. This is not a medical printer by any standards. And our innovation was basically making the ink, right? This is just a very homemade kind of research setup. And we are basically able to make this ink, which basically gives us the advantage, because by making the ink, we can actually put an antifungal agent into it. And therefore, we were able to actually treat. We are currently trying to make this into a product, and we have a company around it. So we are trying to make this a product, and we want to give it to patients. We are hoping before the end of this year. By making the ink, what we can do is put the antifungal agent, fluconazole or amphotericin B, into the actual ink. And what happens is that the antifungal agent comes out right at the interface. So you're not giving the patient an antifungal agent. We all know about the problems with antimicrobial resistance. So we don't want to give them indiscriminate antimicrobials. But the fact that it's coming out at the area where it needs to work is a huge plus for us, especially when we think about denture relining. And for those who are interested, more details about how we do this and what it actually means is in this paper here. So I encourage you to read that. And we have extended this to different kinds of clinical care. So this is, I'm sure you're very familiar with these kind of procedures at the dental school, where you can make these 3D printed splints that actually guide your surgery. So this is a very talented periodontics resident, Dr. Jaewon Kim, who just became faculty at our school. He was doing research in my lab, and he continues to do research. And he published a really nice case report here, which is in this month's issue of JADA, where he showed that by simply doing these 3D printed splints that enable him to place his cuts this takes less than 2-3 hours to build. He's able to very precisely place his cuts and restore the surgical lesion, saving significant time and money and convenience for the patient, because he's working much, much more efficiently. And you've heard of these pre-surgical practice surgeries that we can do actually with phantom heads. So the more complicated the surgery, and I'm sure our oral surgeon can tell you better than I can, all of these surgeries can be actually now practiced with very realistic material. So material that feels like the vessels or the connective tissue or the bone. And you can actually do this procedure, practice this procedure before you actually do more complicated surgeries in your patients. And I think it was emphasized by one of the speakers that these are great models to motivate your patient. Again, going back to the communication aspect, if you can effectively communicate to your patient that you're going to do this procedure, this is what it entails, and this is the end result, they will be a lot more accepting and receptive to the treatment plan. So we also have another paper coming out in Journal of Prosthodontics, which basically shows you how he reconstructed this procedure much more effectively. And these are just pre-op and post-op pictures. For those of you who are interested, you can go and check these articles. They have both of them are published. So people mentioned commercialization of science, and this is one of the things that we've been able to move forward as a company. So this is the company that I co-founded. It's called Optima Technology. And we are trying to bring both the 3D printed dentures as well as several other innovations that we are doing into clinical practice. So there are different ways. All of us want to make an impact. My last slide talks about that. We want to make an impact in our professions and be recognized for it. And we can do that by becoming very accomplished and doing good clinical care. But there are other way of doing this is obviously to make a product that actually becomes useful for patients. So I'll end with the last part, which is actually the most important and relevant area of my research. And this is a little technical, so if you have questions, I'm happy to stop and answer them. So in biology, one of the most underappreciated facts in all of our cellular physiology and biology is the fact that every cell in your body has the complete genomic information to make the entire organism. The reason that we get different types of tissues is because some genes get turned on and some genes get turned off. The genes that are usually getting turned off are called homeobox genes. So the reason that this is useful is because if you try to make a red blood cell, you want to turn on the gene that makes hemoglobin so that it can carry oxygen. If you want to make a cell that becomes contractile, like a muscle cell or a cardiac myocyte, you want to turn on that gene, which allows actin and myosin so that it can do the contractile function. Similarly, if you want to make any dental and oral structure in the body, whether it's dentine, whether it's enamel, you have to turn on very specific genes to enable that to happen. Now, I understand this is largely a clinical audience. So a simple analogy for this is that if we understand all the message that you can provide to a cell, a single cell, we can program it. And this is the concept of directed differentiation in stem cell biology and regenerative medicine. So there are many people in the field, including our group, that is trying to program the genome so that we can make a cell of interest. And you can program the genome, and this is just another cartoon showing you that if you plug in the right software, the right information, you can program the genome to do a particular function. Now, how do you write this program? And there are many different people and different labs that are doing this. Most labs that you probably know already are using either small molecules or drugs or regulatory molecules such as growth factors and regulatory RNAs, mRNA, siRNA. There is a smaller subset of the field that is more interested in trying to use biophysical agents. And this can be ultrasound, radio frequency, electrical currents, microcurrents, or light. And the light part is where my lab comes in. And I've been doing this research for the last 22 years. I started as actually a resident in Belgaum, where I was actually training for oral pathology. And the question that I was asking was, can we use light as a drug, right? That was my scientific question. And the reason for that question is all of us are familiar with lasers. And lasers, dental lasers, are very effective cutting tools. And it is based on the fact that you're transferring energy very quickly into the tissues. And this causes photo disruption or plasma-induced ablation. And you've all seen these movies where you zap someone with a laser and he goes poof and he disappears. This is the biological reason you can do that. And again, we use this very effectively. So we use it very effectively for hard tissue lasers as well as soft tissue diode lasers. But we can also use it for biofilms. So again, we have several extensive courses on lasers in dentistry, where we talk about different procedures for perio, different procedures for ortho, and we emphasize the fact that if you can remove biological tissue, either soft tissue, gums, or teeth, or bone, you can also remove biofilms very effectively. So you can actually use a laser. It's not very efficient, but you can use a laser to disinfect a particular area. The two areas that are not so famous or popular are non-surgical light treatments. And one of the reasons I came to Buffalo specifically, this is upstate New York. When I say New York, everybody thinks New York City. But there is there's a big state, and right at the corner next to the border, Canadian border, there's a city called Buffalo. I guess our claim to fame is that we have the Niagara Falls in very close to our city, and everybody knows Niagara Falls. So Buffalo is famous for Niagara Falls, but it's also very famous for this technique called photodynamic therapy. And this is basically a non-surgical, non-thermal way of disinfecting or being tumoricidal. So there are treatments where you can light up a tumor by giving them a nanoparticle or an antibody, which selectively highlights a tumor. And then providing the right wavelength of light, you can destroy this very selectively. And you can do this with biofilm. So you can light up any bug, fungus, bacteria, even virus, and you can effectively eliminate them by using light. And this is based on that simple principle. We have all done this experiment where we have taken a magnifying lens and tried to concentrate the sunlight and burn tissue, right? By focusing that energy on a very specific spot, we destroy that entity and let the other surrounding areas survive. And that is the principle of photodynamic therapy. The other treatment, which is very, very less known unless you work with lasers, I know some of your faculty are trained in lasers, is called photobiomodulation or low-level light treatment. It's also, unfortunately, also called cold laser treatment. So the concept of a laser was first proposed by Albert Einstein, the fact that you can get spontaneous emission or stimulated emission of radiation. But it took, and he published this paper in the early 1900s, but it took another 60 years for people to actually build a laser. And again, for people who do medical research and clinical research, this professor, Dr. Andrea Mester, discovered that when they made this new laser tool for surgery, it used to beautifully cut, right? Compared to the blade, it was able to cut and seal. It can photocoagulate as it cuts very efficiently. But Dr. Mester did a dose escalation study where he was looking at different doses of light and found that wounds in the back of the mouse actually stimulated healing when he used very low amounts of light. And he called this term photostimulation. You can see another procedure, which is not very evident here, but the fur on the back of the animal actually grows back much faster. So he called this process photostimulation. And for those of you who do research and even clinical training, we all use this website called PubMed, right? Which is basically a scientific database that is maintained by the National Library of Medicine. So the National Library of Medicine is based in Bethesda, Maryland, where they archive all of the scientific literature. And they archive this information under something called medical subject head term, a MESH term. So when something is a MESH term, it is recognized as a separate entity. So this treatment that I work on as a primary focus is called it's called photobiomodulation. It used to be called low-level light treatment or cold laser, but it is now defined as the use of non-ionizing source of light or photonic energy to generate non-thermal therapeutic benefits. And the reason we like this name photobiomodulation is because if you use the right amount of light in the right protocol, you can stimulate certain positive processes such as wound healing and tissue regeneration. And you can modulate the immune system. But if you use another protocol and another delivery system or a different wavelength and dose, you can inhibit certain negative processes such as pain, inflammation, and an aberrant immune response. So this procedure has gained much momentum. And one of the main reasons it has become more popular is because we have now understood that there are very specific biological actions in the cell that are responsible for this therapeutic benefit. Just like, to draw an analogy again, just like visible light enters your eye and changes the conformation of rhodopsin so that we generate a signal which is perceived as vision, we now understand that photobiomodulation can change very specific molecules in the tissue. And the one that is very, very well worked out is the mitochondrial enzyme cytochrome C oxidase, And there are various pain receptors on the neuronal membrane surface, such as TRPV1, which can be selectively modulated with light. And this other mechanism, which is actually our contribution to the field, this involves a growth factor called TGF-beta, transforming growth factor beta. And this growth factor has actually shown to be pro-healing. So by activating it with light at a specific dose, we can promote wound healing and tissue regeneration. And one of the techniques that we have used, that I'll come to that in a second, is in the dental field area, dental dentistry area. So this treatment is gaining a lot of ground. And if you have never heard of it before, I suggest that you look up this particular reference. It is a good overview of the different applications of light. And you will be astonished to know that by using light and light alone, in some cases, you can treat diseases such as Alzheimer's and Parkinson's, age-related macular degeneration, as well as tendonitis and arthritis in your knee. The most exciting part as dentists is that there is growing amount of evidence for its applications in clinical dentistry. And for those of you who are learning dentistry actively, we know that we are always going by textbooks and clinical case reports. And our next level of evidence is controlled clinical trials. But the highest level of evidence is systematic reviews and meta-analysis. So there are several systematic reviews and meta-analysis for the use of photobiomodulation in all of these things listed here. Everything from tinnitus to muscle fatigue and improved wound healing. The most relevant part for dentistry is this particular group of papers. If you have heard of this, probably the surgeons and radiologists have heard of this. There is an organization called the Multinational Association of Supportive Care in Cancer, MASC, and they put out guidelines on where the field is at with different treatments, new treatments that are coming on. So back in 2013, they published a paper where they showed that there is increasing evidence for the use of laser and other light devices to treat and manage oral mucositis after radiation or cancer treatments, or even transplant. The bone marrow transplant also lead to a very specific GVHD mucositis in the mouth. As of now it's already 2 years. So as of 2019, we have a systematic review and meta-analysis recommending this treatment as standard of care. So oral mucositis now, every patient can be given this treatment to enhance their clinical supportive cancer care. Here's another example of where we can use it to treat radiation trismus or mucositis, fibrosis in the jaw. And there are, again, 2 case reports on how we use this treatment to significantly improve mouth opening in these patients. I'll end with this particular slide. So this is actually one of the focuses of our research, where we are trying to develop a light-mediated regenerative technique for pulp capping. And this technique has been validated in vitro in different lab experiments, as well as in vivo in animal experiments, where we have shown that increasing dentine induction in these patients, in these subjects, can improve the amount of new dentine formation or reparative dentine formation. And these are several articles that came out supporting this. So I'll end with that. And I guess no presentation is incomplete in this era without referring to the COVID situation. And there are, again, several case reports that I encourage you to explore, where photobiomodulation has been used to treat patients very effectively. And if you, there are several case reports as well as documented news reports. So we have progressed significantly. I think all of us, I think one of the themes of this meeting is we are proud to be dentists, and clearly we are doing a lot more than dental research and dentistry if you pay attention to what you're seeing in your patients. So every patient who walks in is a potential breakthrough in our understanding of biology, not just dentistry. And I think there is no better time now than now to get involved with research. So that is my last slide. That is what I'd actually prepared for you guys. But then I saw a lot of questions about what are my career prospects, right? I see a lot of questions coming up. So I thought I would put this together. And this is just a very personal slide, which is my opinion. So the reason that we pursue different professional careers is to be recognized as clinicians and as caregivers. Of course, we need financial freedom and be able to balance our work life. So as a BDS student, which I was at one point 22 years ago, you can successfully build a career by continuously improving your training prospects. If you're so driven and enabled with resources, you can obviously do further training, which improves the scope of your practice. For some of you, it might be an option to pursue training abroad. And again, that's a whole different discussion, but there are very specific mechanisms that allow you to be licensed abroad. And you have my email, so feel free to write to me. And finally, for very, very few of you, you will actually think about research as a career. And if you want to go down that path, my recommendation to you, especially because I get a lot of interest from different dentists to come to my lab, I would strongly recommend that you try and do a master's degree first in any of these fields, biomaterials, biology, oncology, or genetics, and then pursue a PhD. And this is true for whether you're an MDS, whether you're a BDS, whether you're a faculty. We do not, as dentists, have that basic science foundation to do a lot of this kind of research that we pursue in different labs around the world. So if you're seeing interesting cases, absolutely pursue it as a research career, but be cognizant, especially as dental students, that we need to be trained. And it could be simply an observership or an internship in different labs in India. It doesn't even have to be abroad. So with that, I will end my talk. And if you have any questions, I'm happy to take them. Oh, and there are different careers that you can practice once you finish research qualifications in the US or any other places abroad.
Dr. Praveen, thanks for a very delightful presentation. It was very kind of you to join us from New York, from the University at Buffalo. It was very interesting to hear about your experience, and your talk seemed to provide so much help to all those who want to work in the research field. I would personally thank you for your presentation to JSS Academy of Higher Education and Research, Mysore. And on behalf of organizing committee, please accept our sincere appreciation in the form of e-certificate.
Thank you very much for having me.
Thank you.
Dentists can be great researchers is a wonderful message to our participants. Thank you for that, sir. Have a wonderful day.